Hi there! You may have just watched the doc's video on how best medically optimize the trauma patient prior to sending to a trauma facility. However, we know who really manages the patient in the emergency department: the nurse.
Often the nurse is left to ensure the patient is ready for transport while continually evaluating for any changes in the patient's medical status. We're going to highlight some key points to consider while preparing to transfer.
My name's Sherry. I work at St. Mike's Hospital.
And I'm Andrea, and I'm from SickKids, and we've been doing this for a lot of years between us.
So, the key to a successful transfer of accountability and continuity of care is communication. Ensuring all relevant information is gathered and given to the paramedic or receiving nurse is essential to the best possible patient outcome.
We need to know everything, including copies of your chart, labs, medications last administered, blood products, trending vital signs, notes, history, and allergies. These are all important to garner your accumulated knowledge of the patient. We also need the weight you've been using for medications and fluids, particularly in pediatrics. Peds nurses like to add extra calculations to our already challenging work. Kids are more complicated, as all medications and fluids are weight-based.
What about family dynamics, religion, and any lateral trauma like loved ones involved in the same incident? All of this will have an impact for the patient and the staff who will look after them. There are different approaches to managing family members, but we're certain that having a family member in the room during the resuscitation or stabilization, and especially with the pediatric patient during transfer, is best for everyone.
With tubes and lines, if the patient doesn't need fluids running during transport, lock them off. The less tubing, the better. Remember, with the children, please don't cover your IVs with gauze or cling. We need to see them. And with Foley's, assess the need or contraindications for insertion. If appropriate, the added benefit is keeping skin intact and the patient as comfortable as possible.
Remember to prevent hypothermia. Due to continued uncovering and assessment in cooler air-conditioned emergency departments, patients get cold and possibly cooler in the back of an ambulance. Keep them covered. Use warm blankets and warm fluids if necessary.
Life-saving tetanus. Did you give it, or should we? We know vaccines are a touchy subject in kids, and a trauma is not the time to break those barriers. Again, communication is the key. We just need to know yes or no, and are they up to date?
Finally, just like you, if a major trauma is headed our way, advance notice allows us to get the team together and better manage the situation. Once your patient is on their way, please give us a call and let us know. Thanks for listening, and have a look at the doctor's trauma video here.